Hello everyone. In this video we are going to discuss about the diagnosis of infertility. History, the age of the patient, the duration of the marriage, the history of the previous marriage, sexual dysfunction, anosmia has to be inquired. A general medical history should be taken with a special reference to the sexually transmitted diseases such as mumps orchitis after puberty, diabetes, recurrent chest infection, or bronchiectasis. So, guys, here in cases of infertility, the age because in the later ages of life, that is in women more than 35 years, and in men gradually the infertility decreases, the fertility period decreases and they become infertile, women become infertile, and men infertility does not occur, but gradually the fertility is going to decrease. The duration of marriage is very important because it requires at least 1 year of regular unprotected coitus for a person to become pregnant or to conceive a pregnancy. The history of any previous marriage, the sexual dysfunction, if he has any erectile dysfunction or the person is impotent, if he is not able to keep an erection, this has to be inquired in the history. And also the anosmia. Anosmia, there is absence of smell. In the Young's syndrome, along with the sperm defect, there is also anosmia. So, if there is anosmia in a person, it will give a clue for the diagnosis. That's the reason we ask about anosmia in the history. So, in history, you're going to ask about the age, the duration of his marriage, and any history of the previous marriage, sexual dysfunction, and anosmia. Then we take a medical history, we give special reference to the sexually transmitted diseases. The sexually transmitted diseases can make the person infertile because of the the attack by the bacteria and the viruses which locally attacks the genital organs, making the person infertile. Mumps orchitis after puberty. In mumps orchitis, there is inflammation of the testicles and epididymis. Diabetes, recurrent chest infection, and bronchiectasis, they will deteriorate the health of the person. They also can make the person infertile. Inquiry about the relevant surgery such as herniorrhaphy, operation on testis, also about the sexual history, his social habits, particularly heavy smoking and alcohol, are of importance and are to be made during the history. So you guys, here they're saying herniorrhaphy. Herniorrhaphy, it is a surgical procedure done during the repair of the hernia. During this, they can cause a damage to the vas deferens. That's the reason you need to ask if they have undergone any repair of the hernia. If they were suffering from hernia, herniorrhaphy is performed, and also an operation directly done on testis. You also need to ask the sexual history. Along with that, any social habits, particularly what are the habits, that is alcohol, which will inhibit the spermatogenesis, and the smoking as well, which reduces the sperm count. These habits can make the person infertile. So the social habits, his habits are also to be inquired in the history. Physical examination, then we do semen analysis and hormonal analysis. Examination, we need to do a full physical examination of the person to determine the general state of the health. If the person is healthy, for that you need to do a full physical examination of the patient. And in particular, the examination of the reproductive system, which will include the inspection and palpation of the genitalia. First, you need to inspect the genitalia, and along with inspection, you need to palpate the genitalia. Attention should be made to the size and the consistency of testicles. You see the genitalia, by palpating, you need to pay an attention to the size and also the consistency of the testicles. The testicular volume, when it is measured using an orchidometer, it should be at least 20 ml. So how much is the volume? Testicular volume, it is 20 ml. The presence of varicocele should be elicited in the upright position. Guys, you see in varicocele, there is inflammation of the veins. During that condition, what happens? We need to, the varicocele will impart a temperature, higher temperature on the testicles, which will cause the death of the sperms. So, we need to figure out if there is the varicocele present in the patient by eliciting the testicles in an upright position. Investigations. The routine investigation will include the urine and blood examination, including the postprandial sugar. So urine examination, urine test, blood test, and also the sugar test is done. These are the routine investigations. Very important, once the patient comes with a complaint of infertility, you need to do the semen analysis. Semen analysis, this should be the first step in investigation, because if some gross abnormalities will be detected, the gross abnormalities could also be the azoospermia, that is absence of sperms. The couple should be counseled for the need of assisted reproductive technology. So you see here what's happening when you investigate, there are some gross abnormalities, that is the sperm is absent. So here you cannot increase the sperm count since they are absent, nothing can be done. You need to counsel the couple for the assisted reproductive technology. How do we collect the semen? The collection is best done by masturbation, failing which by coitus interruptus. Guys, you see here, you should never ask the person to get the sperms collected from the house. Usually the patients ask us, can we collect the semen from the house and bring it to you the next day? No, it is not entertained, because the liquefaction of the semen occurs and the sperms will be liquefied. So it is very necessary that it should be collected in the laboratory itself. It should be either done by masturbation. If it is failing, it is by the method called coitus interruptus. The semen is collected in a clean, wide-mouthed dry jar glass. The sample should be collected and should be sent to the laboratory as early as possible, as the examination can be performed within 2 hours. You see, as early as possible, you need to send the semen to the lab, so that the examination is performed within the 2 hours of collection of semen. The coitus should be avoided for 2 to 3 days prior to the test. You see, abstinence. You need to ask the patient to have an abstinence from the sexual intercourse for a period of 2 to 3 days. Minimum 2 to 3 days, there must be abstinence. He should avoid sexual intercourse. It is because there will be false sperm count. If the patient have sexual intercourse the previous day and comes for the test the next morning, what happens? It will give you a low sperm count. Again, if he is having an abstinence for a week, it can result in high sperm count. It will give you a false sperm count. That's the reason you have to ask the patient to have an abstinence for around 2 to 3 days only, and then collect the semen, so that you get the accurate sperm count. Now let us look into the semen analysis, which is given by World Health Organization. 210 have given the specific values. Normal reference value and low reference within the parenthesis limit. You see guys, there is a normal reference value or there is a lower limit value, lower reference value, which means minimum, at least it should be so much. So here the volume should be 2 ml or more than 1.5 ml. It could be 1.5 to 2 ml. pH of the semen should lie between 7.2 to 7.8. The viscosity of the semen is less than 3. On the scale of 0 to 4, it is not 0 to 7, the scale is taken 0 to 4 and the viscosity is less than 3. The sperm concentration should be 20 million per ml, or the lower limit is at least it should be 15 million per ml. Total sperm count, since the volume is 2 ml, so totally it is 20 into 2, it should be more than 40 million per ejaculate, minimum 13 million per ejaculate. Motility, that is the ciliary movement, forward motility of the sperm, it should be more than 50% progressive forward motility. The progressive motility, at least it should be 32%. Normal, it is 50% of the sperm should have a progressive motility. The morphology, this more than 40% should be normal form, or minimum 4% should be normal. The morphology of the sperms more than 40%. The correct morphology will be an oval head with a long tail. Viability, that is living sperms. How many they should be? They should be 75% or more living. Minimum 58% should be living. The leukocyte count should be less than 1 million per ml. The round cell should be less than 5 million per ml. The sperm agglutination should be less than 10% spermatozoa with the adherent particles. So guys, in here the important ones you have to remember: the volume, it should be 2 ml. Then you come to the pH, it should be 7.2 to 7.8. Viscosity less than 3. Sperm concentration 20 million. Total sperm more than 40 million. Motility more than 50%. Morphology 14% normal. The viability, how many should be alive? The 75% out of the 100% should be alive. The various methods used. Now let us move on to the female thing, with the diagnosis of ovulation. The various methods which are used to detect the ovulation are grouped as follows. They are indirect method, direct method and conclusive method. So when you diagnose the ovulation, whether the ovulation has occurred, how do you diagnose it? Indirectly by the menstrual history, the evaluation of the peripheral or end organ changes. Now, how do you evaluate the peripheral or end organ changes? It is by basal body temperature, cervical mucus study, vaginal cytology, the hormone estimation. Hormone estimation of serum progesterone, serum luteinizing hormone, urine luteinizing hormone, serum estradiol. Along with this, endometrial biopsy and sonography. These are indirect methods. Indirectly you are going to diagnose. How guys? By recording the basal body temperature, the mucus study, the cervical's mucus study, vaginal cytology. You see, so in the cervix, mucus study, vaginal cytology. And also we can estimate the hormones and get to know whether the ovulation has occurred or not. It is the hormones are serum progesterone, serum luteinizing hormone, urine luteinizing hormone, serum estradiol, endometrial biopsy, sonography. These are the indirect methods. The direct method will be laparoscopy, and conclusively it is pregnancy. So the pregnancy will conclude you guys that ovulation has occurred. The pregnancy itself is a proof that ovulation has occurred. This is conclusive. Directly you can visualize the ovulation happening by laparoscopy. Now let us move on to the each of the diagnostic methods. Observation. First we'll start with the basal body temperature. This is a biphasic pattern of temperature variation in the ovulatory cycle. So guys, here in a normal 28 day cycle, there is biphasic two types of patterns. Biphasic pattern is found. First, if the pregnancy occurs, the rise of the temperature will sustain along with the absence of the period. Guys, you see here what happens basically, I'll tell you. There will be a normal body temperature. Then, prior to the ovulation, on the ovulation day, it will decrease by 0.5 degree. Then, after the ovulation has occurred, 2 days after the ovulation, the temperature is going to raise by 0.5 to 0.2 to 0.5 degree Fahrenheit, and then it will sustain throughout the cycle in the same way. That is what they are saying here. If the pregnancy is this is the second phase of the cycle, it is going to remain raised during the throughout the second half of the cycle. It is going to remain raised by 0.2 to 0.5 degree Fahrenheit, and prior to 2 days of the next cycle, it is going to fall. So guys, I'll show you in a schematic way what happens. First, what happens? Normal body temperature for the first 14 days of the cycle. Okay. On the 14th day, the ovulation is occurring. 1.5 degrees Celsius, it is going to fall. Then the second half of the cycle, that is 14th to 28th day and so on, what happens? The cycle will remain, the temperature is going to remain raised from 0.2 to 0.5 degrees Celsius. Then what happens? 2 days before, the 2 days before to the next cycle, it is going to fall again. So you see here, the temperature is normal, it is falling. Wait, I'll explain you with this. What happens? The temperature will be normal and normal, then it falls down, then it remains raised. It remains raised throughout the second half of the cycle. Then 2 days prior, again it is going to fall. So normal fall, raised fall. So this is a biphasic pattern. Okay guys. Now you see here, The fall will now I'll explain with the presentation. The principle of this is, you see here, it is a biphasic pattern of the temperature. If the pregnancy is going to occur, the rise of the temperature will sustain along with the absence of the period. So we saw that in the second half of the cycle it will remain raised by 0.2 to 0.5 degree Fahrenheit. 0.5 degrees Celsius. So this raised temperature is going to keep on sustaining throughout the pregnancy, and also along with this there will be absence of menses in the pregnancy. In an ovulatory cycle, which means the ovulation did not occur, so there is no rise of temperature throughout the cycle. Got it, guys? Ovulation is not occurring, so what happens? There is no rise of temperature. The principle of this is, the rise of the temperature is secondary to the rise in progesterone. So what is the cause for this rise in the temperature? It is because of the hormone progesterone following ovulation. So basically what happens, on the 14th day ovulation occurs, there is a rupture of the ovum and then the residue corpus luteum, which is going to secrete progesterone. This progesterone is thermogenic. So what happens? The temperature is increased because of an increase in the progesterone levels. The primary reason for the rise or increase in the production and secretion of non-epinephrine, which is also thermogenic. So guys, two things which come into play here, that is, one is progesterone. Along with the progesterone, what happens? Even the non-epinephrine, which is thermogenic, is also contributing in the rise in temperature. Procedure. The patient is instructed to take her oral temperature daily on waking in the morning before rising out of the bed. So you ask the lady to check her temperature every day by using a thermometer before stepping out of her bed. The moment she wakes up in the morning, she has to check her temperature. The temperature should be recorded on a special chart. The days when the sexual intercourse takes place should also be noted on the chart for the better evaluation of the coital frequency. So to evaluate the coital frequency as well, the days of the sexual intercourse and also the temperature have to be maintained daily on a special chart. Interpretation. The body temperature is maintaining throughout the first half of the cycle. It is raised to 0.5 to 0.1 degree Fahrenheit following ovulation. So guys, what I told you, the same thing is repeated here. What happens? Here what's happening in interpretation, the body temperature will be maintained throughout the first half of the cycle. This is the first half of the cycle. This is the ovulation day. This is the second half of the cycle. This is 2 days prior to the second cycle. What's happening? In the first half of the cycle, the body temperature is normal. On the day of ovulation, what happens? 0.5 degree Fahrenheit, it is going to decrease. Then what happens? After the ovulation, it is going to increase by 0.2 to 0.5. 0.2 to 0.5 degree Celsius. This is Fahrenheit and this is Celsius. It is going to be increased. Then 2 days, before 2 days of the next cycle, it is going to fall. The same thing they have told here. Hope it is clear. What happens? The temperature will be maintained throughout the first half of the cycle. It is raised to 0.5 to 0.2 degree Fahrenheit Celsius following the ovulation. The rise sustains throughout the second half of the cycle and falls about 2 days prior to the next period. This is known as biphasic pattern. There may be a drop in the temperature to about 0.5 degree Fahrenheit before the rise and almost coincides with either the LH surge or ovulation. So guys, I told you on the day of ovulation, which is almost coinciding with the luteinizing hormone surge, there is a fall in the temperature to 0.5 degree Fahrenheit. The demonstrable rise actually occurs about 2 days after the LH peak and with the peripheral level of progesterone greater than 5 Ng per ml. So they are saying 2 days after this ovulation, what happens? There is a rise in the temperature. This temperature rise is because of the peripheral level of the progesterone being increased to more than 5 Ng per ml. So we know that the temperature is increased because of progesterone. Now let us move on to the clinical importance. Maintenance of basal body chart during the investigation is of help in determining the ovulation and timing of postcoital test. So by maintaining this basal body temperature chart, it will help us to determine when the ovulation occurred, because we know on the ovulation, when the day of ovulation, the temperature is going to fall by 0.5 degree Fahrenheit, and after the ovulation it is going to increase by 0.2 to 0.5 degrees Celsius. This will help us to know that the ovulation is occurring today or the ovulation has occurred. That's the reason my temperature is increased by 0.2 to 0.5 degrees Celsius. This itself, the by herself, the woman can diagnose the ovulation by maintaining this basal body temperature. It also helps the couple to determine the most fertile period if the cycle is regular. Along with the postcoital test, the endometrial biopsy, cervical mucus, or vaginal cytology for ovulation. These tests, that is the endometrial biopsy, cervical mucus study, vaginal cytology, will be discussed in the next slides. So in this slide, you have to know that the temperature will be normal in the first half of the cycle. It will fall by 0.5 degree Fahrenheit on the day of ovulation. After the ovulation, once you have ovulated, what happens? The temperature is going to raise by 0.2 to 0.5. Then second half of the cycle, it will remain raised only. 2 days prior to the next cycle, falls down. So this is a biphasic pattern. This is what you have to remember: the temperatures, how it raises and falls down, and what is the by this the women can diagnose when the ovulation has occurred, and also the most fertile period can be